Hello. I just wanted to first thank you for joining me for this interview about the public health professions. And can you just start by saying your name, your position, how long you've been working in healthcare?
Of course. Hi, my name is Richard Hardister. I'm a registered nurse, and I've been working in healthcare for about 2.5 years now.
Okay. So what motivated you to pursue nursing in college?
Um, I guess there's several different reasons why I chose nursing in particular. I think the main thing is just like it's a way for me to like give back to my community, um, and help people out. Um, it's it's seeing people in like one of the most vulnerable states in their life and helping them get back on their feet, literally. So I think that's like the main reason. But another reason I like it is because it's an opportunity to like constantly learn and constantly grow and constantly expand your knowledge. Every time I step foot into the hospital, you see something new, you see something different, you see something exciting. So there's always a learning opportunity there. Um, and then I also just like the schedule. We work 3 12-hour shifts required to be a full-time nurse. And so you get 4 days off, 3 days on in a week. So I kind of like the schedule as well. And then there's always opportunities for growth. Beyond that, uh, furthering your education as far as like schooling and stuff. So I think that's why I ultimately chose it for a multitude of reasons.
Sounds like you're pretty passionate about your career field, so that's really good. What would you say like a typical night at the hospital looks like for you?
Um, I think the unit that I work on specifically isn't a very typical. Um, so it's kind of hard to say. It all just depends on what's going on in the world because I work on a trauma unit in the ICU. So it really just depends on what's happening out in the world. It could be a car accident, it could be a shooting, it could be a multitude of things. Anything trauma related will come to us. So, depending on the night and depending on what's going on in the world, it can be pretty hectic. It can be slow. It really just depends. I guess what happens when we first come in, we kind of gather around as like a whole unit, a whole group, and we talk about each of the patients on the unit, kind of get like a quick rundown of everybody and why they're there. Um, and then we kind of break down different patient assignments. So in the ICU, typically we have 1 to 2 patients, depending on how critical they are, their level of acuity, and kind of like the workload that you will see with that patient group. So we kind of break it down, try to split up the workload evenly, and then we go and we get a report from the shift that was there before. So I work night shift, so day shift will tell us about the patients that we got assigned. Um, yeah, so a typical night is not really typical on the job that I work, but I think that's a part of the reason why I like it. So
Right, it's not too predictable.
yeah.
What would you say, like, what's your experience with implementing like public health initiatives such as vaccinations? Like for example,
Um, so for each of the patients that we admit onto our unit, we do what's called an admission history. So we try to get as much information as we can about their past medical history, their past surgical history, any like medications that they might be on at home, just so we can like provide the best care that we possibly can for them. One of the things that's detailed in the admission history is like it's called a vaccine assessment. It's just asking them, especially like during a time of year like this where it's like flu season. We always make sure that they have like their flu shot, their pneumococcal vaccine, things like that. So a lot of times we'll get their vaccination records, just so we can try to keep them up to date as possible while they're in the hospital. They always have the option to get up to date on their vaccines. Um, yeah.
Okay. Have you ever had to present or communicate health information to a large audience?
Um, I'm not sure what you define as large.
Like a group of people,
But
maybe like 15 plus.
you mean like in the community or like
Mhm.
at work? I think
Either
the
or, honestly.
so with the unit that I work on, I want to say it's like every month we have like it's called a PPOC meeting. I think it's called a patient plan of care. I think that's what it stands for. Where we kind of just go over like all the statistics for the month. Um, like basically just ways that we can improve and do better in the future. Like we'll calculate if there was any like mishaps on the unit, any errors that were made, um, any infections that patients got while they were in the hospital, just like things that shouldn't happen, so then we can improve on those and better those for the future. We talk about different ways that we can implement certain things, things that need to be worked on, things that we're doing well, and we want to keep going. So we kind of just have like a reboot. Every month there's a meeting. You can come in person or you can come like online via something like this, like a Zoom call, and just talk about ways to improve the workflow on the unit.
Okay. And then what steps are taken like at your hospital to keep the nurses educated as healthcare policies change and like more research is done?
Um, so I think um, it usually starts with we have like clinical nurse educators, we have clinical nurse specialists who a lot of times conduct different studies, different um, assessments at the hospital to like research best practice, to always stay up to date. They're always reading articles. Sometimes they conduct their own research in order to find best practices to best care for our patients. So a lot of times when we do implement things, it'll be either for a trial run or it'll be as a part of a study when we implement new things, to see if that works better than the previous method that we were using before. Or sometimes when we implement new things, it'll be based off of research that has already been conducted. Um, and then another thing that we do, we have like online learning modules that we have to stay up to date with. A lot of times we do them quarterly, so every 3 months, where we stay up to date on our like basic life support, our advanced life support, um, like hazardous drugs and waste materials. Those are some examples of some of the online educations that we do. Um, we even do like workplace shooter stuff, like fire hazard things, just anything that could be possibly foreseen in the hospital in a situation like that. And then just things to stay up to date on our skills and our knowledge. We have online learning for that. So we usually do those every 3 months, I think.
Okay. And then lastly, how does your hospital specifically communicate health initiatives with the public?
I think our role in communicating health initiatives is oftentimes while a patient is in the hospital and also before we discharge them. There's a lot of education, especially if a person has like a new disease or condition that they didn't have before. Um, it's our job to help them learn how to better manage it and um, go through their day-to-day life, managing that optimally. So for example, like if a patient is newly diagnosed with diabetes or something, we can show them how to use insulin and inject insulin, how to check their blood sugar and monitor that. We might have them meet with a dietitian to just find better ways to um, optimize their nutrition, manage their carbs, things like that. So it's all patient specific, but depending on what they have going on and what their health issues are, um, we can like individualize the education that we provide to them.
Okay, well, that's all I had for you today, and I appreciate you taking time out of your schedule to do this interview with me.
Oh, absolutely, no problem. Anytime.
Thank you.